Scott Collen, how long have you been a dentist?
Coming up on 10 years this coming June. Been almost a decade now.
And are you enjoying it?
Yes. Yeah. Every day is a new challenge, sometimes more challenges than others, but I wouldn't trade it.
I know that when you were at UBC and studying, you got the chance to be mentored by Chris Bryant out on the island. And maybe you could just recall for me some of the big lessons that you've learned from Chris and other mentors that have influenced you in the past 12 years or so.
Yeah. Chris has been a pretty influential figure in my dental career. The biggest thing that sticks out in my mind that I picked up from him was his generosity and selflessness. I had cold called him after doing a Google search of independent dentists on the island, and I didn't care where. I just had a Google Maps up with all these little pins and just picking up the phone repeatedly. And without even any word of hesitation, he agreed to have me shadow him for it was like 4 or 6 weeks during the summer between third and fourth year, invited me to stay with him at his house. Yeah, just very open door, welcoming guy. And that really shone through when I was in his clinic, actually getting to see patients of his for the first time, just in terms of the way that he treated them, interacted with them, very casual, friendly, no pretentiousness at all. And yeah, that was a very influential impression on me during those formative years of my dental education. And I know he's gone on to have that effect on many other dental students since I had first reached out to him back in 2012.
How did that impress you? What seemed to be generated by Chris's generosity, like towards patients, for example, or staff members?
Trust, that was a huge thing. A lot of patients of his, I recall being on a first name basis with him. We'd walk across the street and go grab coffee or a burrito, and we'd see somebody that he knows, and it was always a Chris, how you doing kind of thing. And I mean, you couldn't walk a block with a guy without running into somebody that he knows and was willing to say hello to.
That whole thing about generosity and trust, that's really cornerstone of the profession and the life of any professional. Would you agree with that?
We were in a smaller town, and those types of interactions are always going to be more prone to occur when you're in a small town versus a big city where you could go for days without recognizing anybody that you pass on the street. So it was cool to get that side of things. And then, I mean, later on, I was over in Calgary where it was a much bigger metropolitan area. So I got the two ends of the spectrum.
Now, over the period of time since meeting Chris, you've been exposed to other colleagues and mentors that you admire. Any other big professionally related life lessons that you've picked up along the way?
There was a group that I worked with in Calgary when I lived there for a few years, and they were huge on core values and kind of ran the whole ship, so to speak. They hired by them, fired by them. Their whole approach to dentistry was based off of core values. And the dentists that make up that group, and there's kind of 5 original partners, and they've added more since I've left, that cornerstone or foundation of leaning on those values and trying to assemble a like-minded team around that stuck with me, and it was something that I tried to adopt once I opened my clinic here in Vancouver.
So what would have been the values that particularly impressed you, or that they, if you like, that they had written on their mission statement?
Teamwork, respect, exceptional dentistry, and continuous and never-ending improvement.
Right.
So they're called TREC, TREC. There you go.
That's an interesting one. Teamwork is one that probably is spoken about, but mightn't actually be applied. Now, I'm ready to be shot for saying that. But how does teamwork get applied, and how do you apply it in your dealings?
That's a tricky one for me in Vancouver. So I started my own clinic, and starting from scratch, I kind of had that blank canvas, so to speak, of how I wanted to paint my future office's culture. And I think it's a bit easier doing a startup rather than walking into a practice acquisition, where the rest of the team is already set. They've got their kind of relationships, cliques, interpersonal dynamics already set up, and you're walking in without knowing any of that. For me as a startup, I started with my core values printed up on the wall in the lunchroom, in the console room. With the small team, it's a little bit easier to interact with everybody every single day. Whereas now when I've got a team of like 14, 15 people, those interactions that foster that culture are a little bit more difficult to come by. So I block off an entire day every quarter for an entire team meeting, and then we follow it up with some sort of team building activity, whether it's dragon boating, going to an escape room, that kind of stuff.
When I talk to dentists, and over many years, I've spoken to practitioners all over the country, and what keeps them awake at night and what worries them, they'll often say to me, John, it's never the clinical stuff. I can do that. It's the HR, and that's what are the headaches. Have you any insights based on your experiences about how to reduce the hassles related to HR? Give us 2 or 3 key issues that people should think about.
As much as it pains me to say it, I think always being of the mindset that people can leave, and not being solely trusting that somebody's going to spend their entire career at your dental clinic. It's a big pitfall that you can fall into. And so a project that's been kind of a constant and ongoing thing in my office is revising our operations manual for every single position so that it's a little bit easier to onboard somebody, because you don't want to end up with situation like I had when I got back from my honeymoon late last year, where all 3 of my admin team left within a 5-week span. So you want to talk about stress. That's a shining example of it. So having some sort of training manual, document, videos, you name it, to try and onboard people a little bit more easily is something that I'm really banking on, because I learned it the hard way. And those weeks of searching for people and then onboarding them right in the middle of the busiest time of year at the end of the year, it wasn't fun. So standing operating procedure manual, I think that would be a big one. And then having routine meetings to check in with your team members, see how they're doing, see where their pain points may be, if there's anything that you can do about them, rather than just putting on the loops, drill, and not seeing what's going on with the rest of your team as people rather than employees.
I've seen you at a couple of meetings speak to full rooms about starting a practice from scratch. And I picked up, I think, that you believe it can be done. And can it still be done in a place like Vancouver or Toronto?
It's getting harder and harder to say yes to that question every day. I think one of the biggest factors in having a successful startup location, is the location. They say it in real estate, and it's the same thing with startup clinics. You need that really good demographic and site-specific location to get you that runway of patients to be able to cover your startup loan, be able to sleep well at night. And big cities are always going to be in constant states of redevelopment, gentrification, and there's always going to be little pockets of demographics or real estate areas that are going to be prime for startup clinics. It is tough. No bones about that.
It is still doable. Would you do it again, for example?
100%. Yeah. Call me a sucker for pain, but I enjoy the process. I'm actually in the midst of expanding my current clinic right now in the same site. But
imagine for a second if I was a new grad or someone who's out 5 years or less. I'm impressed by what you're saying about that it's still possible to start a clinic from scratch. What would you say are the top 2 or 3 things that I should do?
From a clinical point of view, I think having at least a couple years of real world busy clinic experience under the belt is key. I can't imagine going through the startup process while also being stressed out about the clinical aspect of things. education, I think, is huge. There's a absolute plethora of free Facebook groups, websites, web forums that people talk about startup experiences, not only from a dental clinic point of view, but I mean, I've got a whole bookshelf over here filled with just general business books. You can go to Chapters, Amazon, the local library, and you're getting education on not only construction, but business principles, all that kind of stuff for a fraction of your dental school education cost. And the ROI on buying a $50 book and spending 4 hours reading it is massive, because some of the processes involved in doing a startup, if you screw those up early on, you can't really go back and fix them. It's pretty hard to knock down a wall, turn it, and move it 2 feet once everything is all painted and drywalled and people are coming in, there's a business operating in it. So the education is huge. There's a huge resource pool available to people. The one caveat I will say is that make sure you're aware of who you're getting your information from, because sometimes when you're relying on a major vendor or supplier, there's a motive for them to be selling you their own equipment, which may not be always in your best interest.
Putting together the right team of advisors is a key thing, and it's not easy to know, well, are you getting good advice from XYZ guy? How about facing the responsibility of borrowing money and the responsibility of managing staff? How did you get yourself geared up to be able to take those responsibilities in your stride?
There's a certain, I guess, mental toughness that that's involved when you're juggling all these things, hiring staff, borrowing millions of dollars, dealing with contractors, et cetera, et cetera. As to your question, though, my time in Calgary with that group that I was talking about was really formative, because I could kind of I was in a junior partner position there, so I had a team of mentors. And I mean, when I was there, we went from 5 to 15 clinics in a 3 or 4 year span or something like that. So I was surrounded by all of this for majority of that time and could kind of learn the ropes in that aspect. Now, other people may not have that exact same situation, have that benefit, but I think that's where a lot of those resources that I talked about earlier can really help. Podcasts. There's a huge number of podcasts out there that talk about this stuff.
Tell me a podcast or two that I should maybe think about listening in on.
From a dental business point of view, I mean, Dental Business Mentor, Dentistry with T-Bone, I think it's called, The Making of, Shared Practices, and then just general business ones as well. It's great. I've got a long commute to work. I still listen to those all the time, to and from work.
Okay, Scott, let's just wrap it up for today. Is there any real takeaway that a young grad just has to have on board that you haven't mentioned already?
I would say to not fall into the trap of everything that you were told in dental school. And don't get me wrong, there's a lot of good advice that comes out from dental school faculty and instructors, but there's a whole new, much bigger world of dentistry compared to what you've seen so far in school. And I think it's kind of imperative upon young dentists to really explore that through any of those resources that I've talked about. Because I mean, Canadian dentistry, it's a much smaller industry and market compared to the American side of things. And I've met some really great American dentists, been introduced to courses or products that are only coming up from the States. And I'm happy that I kind of broadened my horizon when it came to looking at the industry and see what bits and pieces made sense for my career and building out my clinic. And the other ones, I was like, okay, that's fine. We can leave them. I'm going to try something else.
You speak about these matters to audiences. Do you have a website that anybody who wants to know what you're up to or some of your thoughts? Is there a website that we can direct people to?
The website for our seminars is snowballseminars.com.
Scott Kollen, it's a joy to speak with you. And thank you very much for spending time with me today. And I'd love to catch up with you again.
Thank you, John. Much appreciated. And yeah, it'll be nice to cross paths with you again.